You've probably met someone in your life who has broken a bone. You may have even broken a bone yourself. You also likely know that broken bones go into casts, and they come out healed. But how does this process work, and does it always work this way? I'm Dr. Adam Goodcoff, and today I'm going to explain broken bones, how they heal, and what happens when they don't. In order to understand how bones heal, we first have to understand a little bit about how bones function and their basic anatomy. The main importance of the anatomy here is the inside versus the outside. Think of the perfect chocolate chip cookie. Crunchy on the outside, but soft and chewy on the inside. The bones are not too different. On the outside of the bone, you'll find hard cortical bone. This is where the term cortex comes from when we talk about bones. Next is the inner soft layer. It's literally so soft that it gets the nickname spongy bone. This layer is more spaced out to allow for blood flow to pass through. The innermost layer is bone marrow. This is actually the site of new blood cell growth. Now there is one layer that I left out. That is the outermost layer that's actually on top of the bone. Think of this as skin for the bones. This is the periosteum. This is the layer full of blood supply and nerves, and when you break a bone, this is what actually makes you feel the pain. So now that you understand the structure and how bones work, let's talk about how they break. In short, there are three main ways you can break bones in an adult. The first is known as a simple fracture. It's a crack in the bone where the two parts are still lined up. Next, in the severity scale, is a displaced fracture. This is a bone that breaks and moves to the point where the two edges are no longer lined up. Lastly, there are compound fractures. These are fractures where the bone does not break cleanly into two pieces, but rather splinters into multiple fragments. There is one type of fracture that is worse, and that is an open fracture. This is an important clinical distinction because if the bone is open to the air, there is an increased risk for serious infection. So how does the body fix these breaks? Well, in fractures where the bone is comminuted, or broken into multiple pieces, the body often can't. In these cases, the patient often requires surgery by way of screws, rods, and plates. But let's focus on what the body can heal: bones that are lined up. Fractures have 4 phases of healing. The first is known as hematoma formation. This is where the blood vessels in the periosteum start to form clots around the areas of bleeding. This happens in the first 1 to 5 days. The next 5 to 11 days form what is known as the fibrocartilaginous callus. This is a soft jelly-like cement that starts to glue the bone back together and lay scaffolding for other bone cells to come into the area. So that's the first 2 weeks. Starting around the second week, the bone starts to be laid down over the cartilage that we talked about above. This is known as a bony callus. This is the hard cement that will actually hold the bone together. Lastly, we have what's known as bony remodeling, which occurs from day 18 and onward. This is where one of the most important phases occurs. It's known as endochondral ossification. While it's a fancy word, it's essentially the same as rebar in concrete. The bone is strong to start, but adding endochondral ossification, or rebar, makes it much, much stronger. This is really why you have to wear a cast for a few months. Despite the bone getting close and cemented back together, we need to form that rebar for long-lasting strength. If you learned something in today's video, please give this a thumbs up and consider subscribing to have your health explained.